Obamacare, marketplace plans, Affordable Care Act plans, whatever you want to call them, have become extremely popular since their implementation over a decade and a half ago. Now, since the very beginning, there have been hiccups and problems, and every administration has sought to address these. Recently, some legislation has been proposed that will affect thousands, if not millions of people, and understandably, this will evoke some very strong emotions. We do ask that you keep things civil and constructive in the comments. Thank you. The Affordable Care Act, more frequently known as Obamacare, has been in act for over a decade, almost 15 years at this point, and it has provided quality health insurance for millions of Americans, particularly those who are low income. However, the Affordable Care Act has faced numerous problems, from rising premiums to fraud, and the Trump administration has sought to correct these issues, particularly the fraud, with some rather potent legislation. But these changes may have unintended consequences, particularly making it much more difficult to sign up. So in today's video, let's do a deep dive into those proposed changes. On Monday, the Trump administration proposed its first major set of regulatory changes to the ACA, particularly cracking down on fraud. Now, it is undeniable that there have been instances of fraud with ACA plans. People signed up without their knowledge or switched plans without their consent. Usually this is localized to rogue agents or a few bad actors. Now, these proposed changes are intended to ensure that taxpayer dollars are not being used erroneously, but not everyone is convinced that this will improve the current system. These changes come after a concerning rise in fraud within the ACA system. Last year, the Centers for Medicare and Medicaid Services received a staggering 274,000 consumer complaints. As I said, many of these were related to fraudulent actions of rogue insurance agents and bad actors. So this is something that the current administration is aiming to curb with these new rules. However, experts warn that these new regulations will really just make it much more difficult for consumers to sign up, especially those with lower incomes. So let's take a look at what these proposed changes entail. One of the main changes is that consumers will now have to provide more documentation to prove their eligibility for premium tax credits or special enrollment periods. This means people might need to provide proof of income, family status, or other qualifying events, which could be a challenge for people who don't have easy access to such documents. In addition, the administration is proposing to shorten the open enrollment period. Currently, in most states, it actually goes to January 15th. This would shorten the open enrollment period to December 15th in most states. And this could make it more difficult for people to sign up due to extenuating circumstances. The proposed changes would also limit special enrollment periods. Currently, you're eligible for a special enrollment period based on many qualifying life events, namely changes in household size, changes in your current insurance, like if you lose your job and therefore no longer have access to your health insurance, or if you move to a new geographic location. Now consumers would need to provide more evidence that they're eligible for these special enrollment periods. More paperwork, more bureaucracy. These are meant as a safeguard against fraud, but is it just making things more difficult? Look, I can't deny it is going to make things more difficult. You're just going to need to provide more documentation, and that's another step. Now, is it more difficult enough that it's actually going to be an impediment to people signing up? That's yet to be seen. That being said, if you do need assistance with your health insurance, we highly recommend that you work with a broker, especially if these changes do become enacted and things are different than what you've been used to in the past. It would be especially helpful to have a liaison who works on your side as opposed to that of the insurance carrier. So if you do have questions about your health insurance, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers and we're licensed nationwide. And there's of course absolutely no charge for our services. Now, we do expect some changes in the coming months and years, so please make sure to subscribe to this channel to stay up to date, and also please make sure to like this video so we can get this information out there. All right, let's get back to it. Another significant proposed change is that for those who are enrolled in $0 monthly premium plans, they would actually be charged a low monthly fee, a low monthly premium, until they could provide that documentation. Now, this could potentially put some financial strain on those who are in lower income households. These may be unfortunate roadblocks, but again, with the assistance of a broker, it's likely that you'll be able to overcome them and still have a smooth enrollment process. Now let's talk about some of the more controversial aspects. The Biden administration extended ACA coverage to Dreamers, those who were brought here as children and are currently living without legal status. Now, this is actually currently being challenged in courts, so who's to say if this will actually come to fruition? And actually, any of these proposed changes have not yet been guaranteed. We don't know if they will take effect, if they'll take effect in 2025, 2026, or beyond. Additionally, under the new proposed changes, gender-affirming care would no longer be covered under the 10 essential benefits. This means that individuals who need gender-affirming services might have to pay out of pocket for these treatments or seek out plans that offer this care as an add-on, which could increase their healthcare costs. So it's obvious to see that there are, of course, trade-offs. While the intentions may be to curb fraud, it may have negative impacts on the everyday consumer. Cynthia Cox, Vice President of the Kaiser Family Foundation and Director of the Program on the ACA, believes that should these changes take effect, it will have a downward effect on ACA enrollment. As more paperwork is required, individuals who already find it difficult to enroll in an ACA plan, specifically those with lower income, may find it more difficult than ever, possibly impossible. This would, of course, further reduce Americans' access to health care. The changes would also affect gig and seasonal workers, which is a very large component of people who are enrolled in ACA plans. Currently, you have to estimate your income for the upcoming year, but these individuals won't have filed their tax returns yet. Now, under the proposal, these individuals would face new requirements to verify their income, adding complexity to the process of applying for subsidies or coverage. So let's zoom out a bit. Now, while the intention of these changes is to crack down on fraud, experts agree that this may limit Americans' access to healthcare and healthcare coverage. And some may absolutely benefit from the fraud protection. For example, those enrolled in a low premium monthly plan will receive a monthly bill. But there's a concern that the increased administrative burden will severely impact many people's ability to enroll in a healthcare plan. It's worth noting that the Biden administration had actually already taken preventative measures to crack down on fraudulent activity. These included requiring three-way calls between insurance brokers, their clients, and the federal insurance marketplace when certain signups or changes were made. This was part of an effort to reduce fraud without making it more difficult for consumers to sign up. So the Trump administration has taken a more aggressive approach to curbing fraud. So where does this leave us? Well, we're now in a public comment period, where individuals and groups can weigh in before the regulations are finalized. As I said earlier, the debate is far from over. It's unsure whether these changes will take place at all, will take place in 2025, 2026, or beyond. Proponents of these changes argue that protecting taxpayers and ensuring that it serves those that need the ACA the most is the utmost priority. On the other hand, critics warn that it could create unnecessary barriers, especially for those who are already challenged when it comes to enrolling in health insurance. So what do you think? Let us know in the comments below. But as I mentioned earlier, please keep it kind, civil, and constructive. If you have questions about your health insurance, we'd highly recommend that you check out this video over here to learn more about marketplace plans in 2025. You can also check out our All About Marketplace playlist. If you have further questions, you can reach us in the comments below, where we would love to hear from you, or at the number on the screen. As always, please make sure to like and subscribe. And remember, we are licensed nationwide, and there's absolutely no charge for our services. We'll see you next time.